Good morning, Arizona, and welcome back. There is no doubt about it. This school year has started off in a very different way as most of our kids are returning to the classroom virtually. And while that can seem stressful for parents and teachers, it is really important to remember it is also stressful for your child, and you need to keep their mental health in mind. So we're checking in with Tess this morning with some steps and expert advice on how to make sure that we're supporting them and observant of what we need to be seeing.
Good morning, Olivia. That's right. We know school isn't just made up of class and homework. It's also about the social interaction. And sadly, that's what the kids are missing out on by being online for school. They're not getting to physically see their friends. They can't have real conversations face to face with them. There's no recess, no PE. The list goes on, right? And that can take a toll. So that's why this morning we are talking about supporting your kids' mental health with Elizabeth Rice. Dr. Elizabeth Rice, thank you for joining us this morning.
Good morning, Tess. Thank you.
This is one of the big complaints of a lot of families saying virtual school, it's not the same, obviously, as being face-to-face. How does that affect a child's mental health?
Yeah, the child can be experiencing a variety of emotions, but often what we see is for the frustration and the anger. So when your child is lashing out in anger, to be able to take a deep breath, take a moment, and realize that they're probably hurting in some other way underneath the surface can be really helpful to start engaging them in conversation and help to understand what exactly it is they're feeling.
And even if we don't physically see it, they are going through a stressful time. Kids just don't know how to usually talk about it or even bring it up. So where can parents begin in terms of helping support their mental health? How do we get that interaction for them?
Yeah, so the interaction is important. So having your child in a centralized location for their learning can be helpful to encourage interaction with them throughout the day. So maybe in the kitchen versus back in their bedroom, making sure that you're scheduling time with their friends via phone call or a FaceTime call so that they're getting that interaction, even though it's not in person, will be really important for that social aspect.
You talk about, obviously, like maybe doing a FaceTime. The great thing is we do have that technology out there, right? So kids can FaceTime, kids can Zoom call. What about, as parents, getting them to talk to us, to be able to check on their feelings? How do we do that?
So being very specific with your questions can be really helpful. And then also knowing what your child responds best to. Maybe they're more of a physical affection child, and so they need a hug or a touch on the arm or a rub on their back throughout the day. These little things that we can do can really help to encourage our child to open up. And just being open to talking with them and checking in with them. How are you feeling? Is anything worrying you? How does your body feel? Are you having any stomach aches or headaches? Asking these sorts of questions can get our child to start talking, and if we can get them to start talking, then maybe we can get them to open up a little bit more about what they're feeling, even if we're not seeing it in their behavior or their mood.
All right. And that's, of course, our job as parents is to sort of set the example. We know families are stressed out there, parents, whether they're working from home or going to work. There's so many stresses that come with the pandemic right now. So we also need to lead by example, right?
Absolutely. Our children are like little sponges and they feed off of us. So taking care of ourselves is going to be really important in this situation.
All right. Dr. Elizabeth Rice, thank you so much for sharing these tips on how we can help support our children's mental health. So important right now.
Absolutely, Tess. Thank you.